I'm Claire, I'm a Unison rep, I'm Assistant Branch Secretary for the Greater Manchester Mental Health Branch and I'm on strike today. The staff and union members that you see over there on the picket line are taking a day's industrial action today, followed by 6 months work to rule. It's the culmination of a 4-year-long grievance over a lack of funding for the essential resources and staff that we need and that the members need to be able to deliver early intervention services properly and safely for the members of our communities.
I'm John Mulligan, I'm a Unite rep and I'm also a worker currently on strike on behalf of the Manchester Early Intervention Service. We've been in negotiations for quite a long time now. We've witnessed our services and the community mental health services locally in Manchester deteriorating over the years, and we've been concerned for quite a long time. So we've got to the stage, unfortunately, where we've seen no other option but to strike. For the last several years, the community mental health services, the services for adults with more severe and enduring mental health difficulties, have been very problematic indeed.
The service is designed to support people who are experiencing a psychotic episode for the first time. So it's for people who might be experiencing symptoms like feeling paranoid or hearing voices. It can be a very distressing and frightening time for people experiencing those symptoms, and it can be very distressing and frightening and feel quite isolating for families as well. So it's really essential that early intervention services are properly funded to be able to give those people and their families and their loved ones the support that they need. And we know that if those services are invested in properly, they're really good at helping people to recover, and they reduce hospital admissions, they reduce suicides by 50%. But unfortunately we are not getting the resources needed for these teams, and what that means is then people do end up needing hospital admissions more frequently. If people aren't getting the support early, they can end up needing having unnecessary hospital admissions, often far away from home and away from the loved ones in out of area hospital beds, which doesn't the only person that benefits is really private healthcare providers. The cost of that, I mean, what we're interested in is the human cost and the people who need these services and their families. But if we do talk about financial costs, it costs over £1,000 a night to put somebody in an out of area private hospital bed, when you could spend a fraction of that for staff in the community, which would prevent the need for that addiction occurring in the first place.
There's a bit of a vicious cycle at the moment, whereby we're not getting enough funding to do the basics, we're not getting enough funding to do the preventative work that we want, and then that means that it's much more expensive down the line, where the trusts and the local ICP have to pay huge amounts of money for hospital admissions and for out-of-area bed placements with private organisations. That vicious cycle really needs to be broken. The only way, unfortunately, we can draw attention to this at this stage is to come out in the rain, to lose a day's pay, and to try and draw some attention to the serious issues.
This strike is Unite and Unison members in the early intervention service. The members include staff from every professional group. That includes people from psychiatry, psychology, CBT, welfare rights, support workers, admin staff, social workers, nurses. Every staff group is represented.
This is a joint effort between Unite and Unison. You can see all of our colleagues and friends and supporters and allies in the background. Don't forget about us. And when I say us, I'm talking about our service users and our families and people who use secondary care services. What tends to happen is people suffer in silence for many, many years. You can see across England, we know already that people are dying every day unnecessarily across England. We know that the life expectancy for people who are involved in secondary care services is 59 for men, 67 for women. We know this for years and years and years, and what tends to happen, sadly, is that when there's a serious incident, the media pay attention for a couple of days, politicians pay attention for a couple of days, but then they talk about reviews, they talk about reforms, and then they talk about big numbers, and then everybody switches off again and goes back to the day-to-day business.
We know that in Manchester the level of need for mental health is about 60% higher than the national average, but at the same time we get significantly less money compared to the national average. At the same time, we're being told now that actually services have overspent, and across Greater Manchester Health Services estimates to be savings of £180 million, which we don't accept, because how can you overspend when you've already not had enough money in the first place? So we want to get the message across that actually we need massive investment in these in health services, and particularly in community mental health services in Manchester. And people can support us by contacting your local MPs if you're a resident of Manchester.
We really want to just send a message out to our service users and their families across Manchester, across the early intervention teams, across the community mental health teams, that we're sorry for what's been happening, and we do appreciate the efforts that you put in, and we're disappointed in the efforts and the opportunities that we have to support you in the way that you deserve. So hopefully by striking we'll have an opportunity to encourage central government, because that's really where the solutions lie, to come and give us emergency funding, and to not talk about wonderful transformations that are happening, to not talk about reviews, and to not dazzle us with talk of billions here and millions there. What we actually need is money urgently. We need staff, we need feet on the ground, we need enough staff to be able to support the large number of service users that we work alongside. Bang the drum is to keep on about trying to invest properly and support our most vulnerable members of society, and that's what we're talking about. We're also talking about our most amazing and fantastic and creative and strong members of society, but we're talking about our most vulnerable, and how we treat our most vulnerable members of society should reflect on us. We should think about that, and we should actually act.
You can follow us on Twitter. Our Twitter account is @MankStrikeNHS.